Greetings, my name is Section Sergeant Candace Reichner, and I am the NCOIC of the ADAP Clinic. The ADAP Clinic is located in McCord Clinic, and our phone number is 253-982-3685. Today, our briefing is going to go over the services we offer, as well as the local laws in Washington State. We really want to thank you and welcome you to the Joint Base Lewis McCord family. ADAP, Alcohol, Drug Abuse Prevention and Treatment Program, and I'm your briefer, Technical Sergeant Candace Reichner. Today, we are going to go over the mission, referrals, readiness, alcohol use, drug use, and intervention and services available. The mission for ADAP is to provide services as well as treatment for those with substance use concerns. We are here to promote readiness through prevention and treatment. Our specialty is within the Behavioral Health Department, and we are here to educate. Those that do come to ADAP for substance use concerns, anyone that does come in, they are going to receive education. For those that do wind up meeting diagnosis for a substance use disorder, they will be offered and recommended for treatment. The mission for ADAP is to minimize the negative consequences of substance abuse to the individual, family, and the mission, as well as return identified patients to unrestricted duty status, or assist them in transition to civilian life if it's appropriate. Overall, we want to help airmen live healthy lives. When it comes to ADAP, we have different methods of referrals. We have command referral. That is anytime there's unfortunately arrest, accident, DUI, public intoxication, any type of notification that the command will receive of alcohol-related incident or misconduct. The command will then notify ADAP, and ADAP will initiate the assessment to see if there's any needs or treatment needed for that referral, for that member. When it comes to command referral, anytime there's a positive urinalysis as well, the command will notify ADAP. The second type of referral we have is medical referral. So medical referral is just anytime your doctor or another healthcare provider seems that maybe there's some type of substance use concerns. And so they refer you to the ADAP so that we can assess, provide education, and treat as needed. For a self-referral is just any member who's just seeking education or services from ADAP. We ask you to come in, and it's truly, truly, truly supported and seen as a strength by command as well as from a medical perspective. If you choose to self-refer, please know that you cannot be under any investigation or pending action. When it comes to readiness, readiness is the practice of wellness, health, and resiliency to enhance the person's well-being as well as optimize human performance. In ADAP, we are aware that people and members and community overall can undergo a lot of stress. And even though stress can be healthy and motivate, stress can also impact people and cause distress. So to promote medical readiness and just readiness overall within a person, we just want you to look at the chart and just get an idea of how stress can impact a member. Common stressors for any family would be family separation, relocations, loss of life, maybe an illness or injury. As stress level increases, it can help you perform to your maximum level, but if there's too much stress, it can lead to a distress zone where it can lead to emotional burnout. So for readiness, we're just asking for you to identify these signs in you and then seek assistance in any way you possibly can. If you're seeking services for substance use or just even type of therapeutic intervention, please come in because we can assist you with both. We want to make sure that everyone is practicing or living a healthy life with healthy coping skills. That's such as talking it out, deep breathing, any type of self-care, practicing sleep hygiene, seeking professional help, making time for you to eat right, sleep right, enjoy your hobbies, exercise, and reduce any type of triggers. Sometimes we need to socialize and sometimes we need to take a break. Unfortunately, there's unhealthy responses and behaviors when it comes to coping to stress. And those type of behaviors or signs that we want to make sure we keep an eye out for is increase in substance use, high-risk activities, any type of withdrawal or isolation, aggressiveness, increase of or potential for violence, maybe appetite loss, or even some type of self-harm. These are things that we should not be doing and that we should definitely seek assistance for. Here in the ADOP clinic, we do want you to know that the services we are able to provide are targeted towards the active duty member due to the size of our clinic. Although, if anyone is seeking services for dependents, we work along with Madigan, the MAMC clinic, where they have expanded services for all dependents. So now let's go ahead and talk about alcohol use. More than anything, we just want you to be able to know what a standard size drink is. A standard size drink contains at least 5 ounces of pure ethanol, alcohol in there. And so our standard size drinks are 12 ounces of a regular beer, and this does not include craft or any type of imported because the alcohol content might be different, as well as anywhere from 8 to 9 fluid ounces of malt liquor, 5 fluid ounces of table wine, or 1.5 fluid ounces of spirits or shots. When it comes to alcohol use, the way your body processes alcohol is different between males and females. If you look at the chart, you would see based on your weight and the amounts of drinks that someone can consume, you would be able to identify your potential BAC, your blood alcohol level. Your blood alcohol level or blood alcohol content is how we identify the level of intoxication and as well as the potential for impairment within someone's body. We really want you to focus on responsible drinking. If you choose to drink, know what responsible drinking is. So don't underage drink, and that's anyone that's under 21. If you do decide to drink, know that 0.08 blood alcohol content is considered legal intoxication. And if you are under the age of 21, your blood alcohol content should always be 0. We want you to know that responsible drinking is also no drinking and driving. And the only safe blood alcohol content to drink and drive is 0. No binge drinking, and what we consider binge drinking is drinking more than 4 standard drinks for men or 3 standard drinks for women within an occasion or within a day. Have a plan before you go out. We do want you to enjoy the area. There's lots to see. So make sure you have a plan. Make sure you speak to a wingman. If you do decide to go out, your plan could include AADD, ride services, a wingman, buddy, leadership. Just make sure you have a way to get home. Responsible drinking is also no breaking civilian laws or Air Force rules. When it comes to responsible drinking, it should not negatively impact your duty performance, as well as it should not bring harm to yourself or to others. In Washington state laws, we just want you to be mindful of when you're in the area. There is a law when it comes to no open containers in a vehicle. So ideally, if you're the driver or even a passenger and you're able to reach back and you can reach for the alcohol, that's one too close. We want you to make sure you transport all your alcohol in the trunk. Public intoxication, unfortunately, happens, but when it comes to Washington state law, anyone who's intoxicated in public that may be a danger to themselves or others can be apprehended. And as well as minor possession. And this is someone under the age of 21 who chooses to consume alcohol. And that also goes for not just minor possession, but if you are above the age of 21 or regardless of your age, please do not supply alcohol to any minor. Out here in Washington, our rules are a little different. As DOD's employees, military members, GS, and contractors, we must abide by the rules for our employment as well as the Air Force values. And when it comes to drugs, it's 0 tolerance. Out here in Washington, they did legalize some drugs that we're going to talk about. But more importantly, I just want you to know these are just drugs that are out there in the community, out there that are used by people throughout the world so that you could be aware of it as well as prevent any type of illegal drug use or abuse of drugs. So the legal drugs we have here is identified as cocaine, meth, ecstasy, and as well as marijuana. Marijuana is actually federally illegal, and as federal employees, it is illegal for us to use. Then we have legal drugs. Legal drugs is like caffeine and nicotine. Caffeine you can buy in either if it's your workout mixtures or even if it's your Starbucks right down the road. We have nicotine. Now for nicotine here in the state of Washington, you must be 21 to purchase any type of nicotine or tobacco products. For over-the-counter drugs, we have Robitussin, NyQuil, and Tylenol. These are the things that we can buy in our local grocery stores. Now, for over-the-counter drugs, we do buy them to treat our symptoms, maybe before we seek professional intervention or medical care, but any type of misuse or using more than intended or instructed on the bottle is considered drug abuse or substance abuse. So please be mindful of that. Then we have prescription drugs. Prescription drugs are anything that a provider, your medical provider, writes a prescription for you. On that prescription bottle, it will actually have your name and the date of your prescription, as well as instructions of when and how you should take it. If there's anyone who winds up taking their medication outside of instruction or even sharing medication with anyone, that could be considered drug use as well as substance abuse. So we want to make sure that we don't participate in any of that illegal activity. Only use medications prescribed to you, and please use as needed. Then we have inhalants. Inhalants are things that we could find like in aerosol cans or things that are just within the air. Usually you can find this when it comes to gasoline, aerosol sprays, the dust off for the computers. Sometimes people have been using hand sanitizers as inhalants as well, where they put it on their hands and then they smell the alcohol off of that. So please know that inhalants can be dangerous. It can lead to oxygen deprivation when it comes to the brain, and can impact the member and it can kill the brain. Then we have designer drugs. Designer drugs are things that we can find out in a community neighborhood where they make these drugs based on any type of chemical and then they sell them. So designer drugs have the worst effect on members because we don't know what's in them, and so it's hard to know what to treat as well as what symptoms might come from it. Now let's just talk about illicit drugs and marijuana. The DoD has zero tolerance policy for illicit drug use. The Air Force policy on legal drug use or illegal prescription drug use is zero tolerance, so don't do it. Despite the changes in some laws, with marijuana being legalized out here in the state of Washington, we understand that we might have dependents or civilian friends that do choose to use this. We want to make sure as DoD members that you refrain from partaking in it, as well as for you to eliminate your presence or your activity towards the marijuana or illegal drug use. Again, the DoD has zero tolerance for illegal drug use and is punishable under UCMJ, and it can include separations. So if you have any concerns whatsoever of any type of illegal drug use, maybe you're not using the substance, but it is being used by one of your family members, just come speak to ADAP and we could assist you and we could help you work out a plan to eliminate any risk when it comes to you and as well as support the choices of your family members. Washington state law. As I said before, in the state of Washington, cannabis, marijuana, it is legal. And it's legal in Oregon as well. It's legal for civilians, not DoD employed civilians, but civilians out in the community to use. If you are a DoD employee, military member, personnel, GS, contracting, it is illegal for you to use cannabis or marijuana. If you have a person or a friend or someone that you're familiar with who is civilian, in other words, non-DoD personnel, who chooses to use cannabis or marijuana, please let them know that that substance is not allowed on base or a military installation, and federal regulations and law will apply. In the state of Washington as well, if someone does choose to use marijuana or cannabis, again, this is people who are not DoD employees. They have to be the age of 21 in order to purchase and possess the marijuana. Public view of marijuana, like if that person decides to consume marijuana, it cannot be in public view, as well as they cannot drive under the influence of marijuana because it is illegal, as well as traveling or transporting any type of cannabis or marijuana outside the state of Washington is illegal. Cannabis is addictive. You as DoD personnel and our families. The services we have for anyone that does have any type of substance concerns, from alcohol to nicotine, caffeine, prescription medications, and sometimes even illicit drug use, please know that ADAP is here to help. We offer outreach prevention services, which means you might see us in your unit. You might see us around base. You might see us at events where we have tables and education booths or awareness campaigns. We also provide briefings like the one we're doing today and any type of education or counseling for those who are just here to receive education or deemed appropriate to receive education. At the ADAP clinic specifically, over here at the McCord Clinic, we do outpatient counseling treatment, which means a person will come here and they would be assigned a counselor for those who meet diagnosis and they engage in treatment. But if they need more supportive services and a higher level of care for their substance use, we work with Madigan, our MAMC clinic, which has more intensive services. And then we also use the community itself for their higher level of care. Please know that we work really close with behavioral health, family advocacy, and civilian transitional services. So if anyone has any needs, we will properly refer and we will assist with the case management to make sure you and your family has everything that you could possibly request. And lastly, when it comes to the ADAP clinic, the service we also provide here too is recovery or maintenance, what we like to call aftercare. So if you do know someone who was receiving some type of substance use treatment and they were like assistance in maintaining their abstinence, please seek out ADAP where we could help support that. Our clinic again is located here at the McCord Clinic. We are located on the second floor along with behavioral health. Our phone number is 253-982-3685. We are open from Monday through Friday, 7:30 to 4:30. We do have walk-in hours from 8 to 3:30. Although if there's any time after 3:30, we are asking if you go to the Madigan Emergency Clinic or the urgent care so you can receive those immediate services. Thank you very much and have a great day.